So let's continue on with diabetes in pregnancy. What are the things that we have to remember? First, nausea may affect the diet and insulin dosage of the client. Macros only occurs in the baby, so the baby is actually large for gestational age. Hypoglycemia occurs in the baby, whereas hyperglycemia occurs in the mom. Human placental lactogen increases the need for insulin. Now take note that your human placental lactogen may actually require adjustment in insulin dose for a pregnant diabetic client. Now let's answer a question. Which problem of the diabetic patient presents as a special concern for the nurse? A. Hypoglycemia. B. Nausea. C. Hypertension. D. Constipation. The answer? Nausea. Why? Because it may actually alter diet and insulin requirements, which are the cornerstone of management of diabetes in pregnancy. Take note, hypoglycemia occurs in the baby, not in the mother. Next, multiple pregnancy. What are the things that we need to remember? Risk for uterine atony after delivery is increased, risk for bleeding is increased, requires additional calories for the pregnant woman. So which client is the most at risk for postpartum bleeding? A. The client who delivered twins. B. The client with hyperemesis gravidarum. C. The client with placenta previa. And D. The client post-therapeutic abortion. Take note, we're actually referring to postpartum bleeding. So the best answer is actually letter A. Twin birth increases the risk for uterine atony, which may in turn increase the risk for uterine bleeding in the postpartum period. Take note that postpartum hemorrhage is defined as blood loss of more than 500 ml in or within the period immediately after giving birth or after delivery. Next, let's actually pay particular attention to abruptio placenta. So what are the things that we need to remember? It is usually related to trauma, occurs in the last trimester of pregnancy. The priority is to maintain fluids and bed rest. Now we have to pay particular attention to the main sign of abruptio placenta, which is painful, dark red, vaginal bleeding. Let's answer our question. 37 weeks pregnant client had a vehicular accident. The nurse will monitor the client for A. Pregnancy-induced hypertension, B. Placenta previa, C. Abruptio placenta, D. Abortion. The answer? Abruptio placenta. Letter C. Why? Motor vehicular accident is a form of trauma, which is actually a risk factor for abruptio placenta. Now, let's talk about Tetralogy of Fallot. What are the things that you need to remember? It's a form of cyanotic heart disease. The complication is polycythemia vera. It involves pulmonary stenosis, overriding of the aorta, right ventricular hypertrophy, and ventricular septal defect. Take note. Let's answer a question. Tetralogy of Fallot involves all of the following defects except A. Aortic stenosis, B. Right ventricular hypertrophy, C. Ventricular septal defect, and D. Overriding of the aorta. The question is actually asking for the exception. So the best answer is aortic stenosis, because it's pulmonary stenosis that occurs in Tetralogy of Fallot, not aortic stenosis. Let's move on. Cystic fibrosis. It's actually a multi-system disease. It affects 4 systems. Take note, it affects the respiratory system, the gastrointestinal system, the integumentary system, and the reproductive system. So it affects the exocrine glands, causes sterility in males, and may cause salty skin. It requires the administration of pancreatic enzyme with each meals and snacks, meaning every time that the child eats, the child would need pancreatic enzymes. So the parents of a child with cystic fibrosis should be referred to A or an A. Urologist, B. Geneticist, C. Nutritionist, D. Physical therapist. The answer? B. Geneticist. Why? Because the disease is genetically transmitted. Next, let's talk about celiac disease. It's also genetically transmitted. It may cause malabsorption of nutrients, and it requires dietary modification. So, let's answer the question. All of the following foods are contraindicated in a client with celiac disease except rice, oats, wheat, and barley. Now take note that in celiac disease, foods which are contraindicated are, we have an acronym, BRAP, barley, rye, which is RYE, oats, and wheat. Now pay particular attention to letter A. It's actually given there to a little bit confuse you. Rice is different from rye, so the answer is letter A. Congenital dislocation. It's manifested by note OTA, ortholine sign, which is a clicking sound, strangling word sign, which is pelvic rubbing when the client stands on the affected leg, and Alice sign, which pertains to shortening of the affected extremity. The priority is to keep the legs in abduction. Usually with the use of public harness or hip spica caps, or conservative treatment would include application of double or triple diaphragm. Next, let's pay particular attention to bacterial meningitis. What are the things that they're likely to remember? It's infectious, that requires isolation, it's treated with antibiotics, and we need to assess chronic sign, which is pain on extension of the lower extremities, and Rudzinski's sign, which is actually nuchal rigidity. It's difficulty in actually flexing the knee towards the front. Okay, let's answer a question. A client with bacterial meningitis should be placed in which type of room? A. Semi-private with a client with tuberculosis. B. Ward room. C. Semi-private with no roommate. Or D. Private room. Take note. Bacterial meningitis is infectious, so the best room is not a semi-private room, even though the client doesn't have a roommate at the moment. Because in a semi-private room at any point in time, the client could be potentially admitted. So the best answer is D. Private room. That's all for now, and see you in all the other videos for the next steps for the nurse licensure exam this year. This is Dr. G saying good luck, God bless, and top the work.